This video is about a really common problem in clinical practice, a trapped nerve in the neck, for which the medical term is cervical radiculopathy. And this can cause symptoms of neck pain with radiating pain, tingling or numbness into one or both arms, often as far as the hand and fingers. So in this video, I'll be explaining exactly what happens in this condition and why, how it's diagnosed, and what the treatments are, from self-help to medications, and also when surgery might be an option. I'm Stephen Bunting, and I'm a specialist MSK physiotherapist working in the UK. Welcome to my channel, where I explain common musculoskeletal problems and the evidence-based treatments behind them, so you can make more informed decisions about your health. Well, the term cervical refers to the neck, radicular refers to the spinal nerve roots, and pathy means suffering or disease. So, cervical radiculopathy means a problem with the function of one or more of these nerve roots. So, the nerve roots branch out from the spinal cord in pairs on each side of the neck, where they then go on to form the individual nerves that run down your arms, supplying them with sensation and controlling the muscles. There are 7 vertebrae in the neck, which we label as C1 through to C7. The nerve roots exit the neck through holes between these vertebrae, and there are 8 pairs of them, which we label from C1 to C8, depending on the vertebral level that they arise from. The nerve roots are vulnerable to compression as they leave the neck, commonly from a bulging disc or the bony thickenings associated with arthritis. And when the nerve root gets compressed in this way, it can cause symptoms of pain, numbness, and tingling within the area of the arm which that nerve goes on to supply, which we call the dermatome of that nerve root. These are the dermatomes of the cervical nerve roots. The most common ones affected by radiculopathy are the lower ones, the C6, 7, and C8 nerve roots. And these are the ones that go on to supply the hand with sensation. So if your symptoms radiate from the neck and into the thumb, then it's likely that your C6 nerve root is being irritated. If symptoms are more in the middle finger, then this corresponds to the C7 nerve root, and the little finger is the C8 nerve root. But it has to be said that there is often considerable overlap and variation of dermatomes between different people. So you don't often get a pure textbook pattern of pain referral. The other symptom that we sometimes see is pain spreading into the scapular region. We also sometimes see weakness of the muscles in the arm or hand. This is less common though, and usually indicates a more severe nerve root compression. A word of warning here though. If you develop severe progressive weakness in an arm or both arms, or if you suddenly develop leg weakness or problems with walking or balance, or any new disturbance with your bladder or bowel control, then we consider these red flag symptoms, as they might indicate a degree of spinal cord compression. And in that case, you should get assessed urgently, usually in an emergency room or an urgent treatment centre. The nerve roots in the neck are vulnerable to compression at the point where they leave the neck and travel through a short tunnel between the vertebrae called the intervertebral foramen meaning hole. Anything which reduces the diameter of this tunnel can impinge upon the nerve root and cause symptoms. In younger people, the cause is usually a bulging disc, which can invade this tunnel and contact the nerve. In elderly patients, the cause is more commonly osteoarthritis of the nearby facet joints, which cause bony outgrowths called osteophytes, which also then invade the tunnels and contact the nerve roots. And sometimes it's a combination of both causes, which we call a disc osteophyte complex. When these intervertebral tunnels are narrowed in this way, the nerve roots can become compressed inside them, on a scale of mild right through to severe. So a nerve root might have some mild contact irritation, maybe some pressure or impingement, or they might be severely compressed. And the symptoms don't always fit with a degree of compression. Sometimes a mild contact irritation can cause far more pain than a completely occluded nerve root. But when muscle weakness or constant numbness is evident, then the compression is usually more significant. The condition is usually diagnosed clinically, meaning that a clinician will listen to your symptoms and then examine you with particular scrutiny of the nerve function in your arms. So imaging certainly isn't always required. But if symptoms are more severe or they aren't getting any better as expected, then an MRI scan is usually the best investigation. Well, the first thing to say is that in the vast majority of cases, the symptoms will usually improve over time. This is because nerves have a remarkable ability to change, adapt, and cope with pressure. They can essentially toughen themselves up so they can withstand a degree of compression. But that toughening up process can take up to 3 months. So the general process with a cervical radiculopathy is to treat the condition conservatively for about 6 to 12 weeks, and over this time most cases will settle down and get fully better. And the main treatment to consider over this time is painkillers, because a trapped nerve can be really painful and disturb sleep, so it makes sense to use a medication to help with pain while the condition is hopefully getting better in the background. Most clinicians will start with simple paracetamol or maybe a codeine-based drug alongside an anti-inflammatory to start with, and then if needed, a neuropathic painkiller might be considered. And a word about sleep, because this can be a real torment for some people, and it's one of the most common questions that I get asked about this condition. So if you have a left-sided nerve root compression, giving you left arm symptoms, then as a rule, a position of left side bend will cause narrowing of the foramen and further pinch the nerve. And conversely, a position of right side bending will open it up and take pressure off the nerve. Positions of neck extension will also narrow the foramen on both sides. So bearing this in mind, for most people, lying on your back or on your good side with your upper painful arm supported by a cushion will usually work best. But to be honest, you've probably already worked this out for yourself. You're going to automatically find the most comfortable position, and it might not be textbook, but trust your own body, as there really is no such thing as a one-size-fits-all position. The best position for you is the one that feels best for you. One thing that does usually help, though, is to take your last dose of pain medication about an hour before going to bed, so that it's working at its maximum effectiveness when you need it to be. Gentle exercises can also help to encourage the healing process, as we know that movement stimulates healing and aids recovery. But let pain be your guide and don't exercise aggressively or you'll just stir the pain up. Just gentle neck rotation movements and then pendular movements of the arm can help to gently move the nerve root through the intervertebral foramen. Gentle, frequent movements throughout the day are best, and conversely, avoid prolonged rest and prolonged static postures, particularly with your neck flexed forwards or extended backwards. But really, the best healer is time, and all we usually need to do over this 6 to 12 week period is to get you as comfortable as possible while nature takes its course. And I know that it can be frustrating to just essentially sit, wait and seemingly do very little while you're in pain, but often it really is the best option. You might be thinking that you need a scan to confirm the diagnosis, but in most cases, at this early stage, a scan is not needed, as it will often just confirm what we already know, and it won't usually affect the plan for conservative treatment for up to those 3 months. The exception to this, though, is if you have any of the red flag symptoms that I mentioned earlier, or if your arm pain is severe and intolerable. In those rare cases, you will probably need an early scan. So, if 3 months have passed and your symptoms are no better, then this is the best time to get an MRI scan. The reason for this is because at this point it becomes less likely that the condition is going to get better by itself, usually because the nerve is more severely compressed. So at this stage, the invasive treatments like surgery or injections might be considered, whereas they won't usually be considered within 3 months because, like I said earlier, for most people the condition will get better by itself within this time, and so it would be foolish to subject a patient to the unnecessary risk of surgery when the symptoms are likely to get better anyway. And because surgeons will want a recent scan to help them plan their treatment, you can now see that getting a scan too early is going to be pointless, as it will just need repeating again at the 3-month mark. So if you are unlucky and the symptoms haven't shown any sign of improvement at that 3-month mark, you've had a scan and it confirms a nerve root compression, then you might now need to see a spinal surgeon. The options at this point will usually be to either inject around the nerve in order to reduce pain and inflammation, or operate to decompress the nerve root. An injection might be offered if the scan shows fairly mild nerve root compression, and surgery might be offered if the compression is more significant. The usual procedure is called an anterior cervical discectomy and fusion, which is shortened to an ACDF. This involves an incision at the front of the neck where the surgeon can then remove any disc or bony material that's compressing the nerve root, and then stabilise the joints. The surgeon will need to fuse the 2 vertebrae together using metalwork. It's a fairly routine procedure done under general anaesthesia, but as with all surgery, there are risks, and you will need to discuss your individual risks along with the potential benefits with a spinal surgeon. Okay, so to summarise, if you do have a trapped nerve in your neck, then don't panic. Most of them do get better over time, usually within 6 to 12 weeks. For some people, the symptoms can be severe over this time, so do get help with pain medication and maybe see a therapist for movement and exercise advice. Okay, well that about wraps things up for this one. If you found the video helpful, then please do like it and subscribe, as this really helps other people to find it. Or you could buy me a coffee if you like. Links are in the description. Well, thanks very much for watching, and until the next one, take care and bye for now.